I did my med reconciliation on Mr. J, a 79-year-old white male who lives with his wife in their home. The med reconciliation took place in their home. The client manages his medications alongside his wife. They work together. And the client had a med list from his primary healthcare provider present with his medications when I was there. So as a young adult, the client had a thyroidectomy. The client has a 20-year history of hypertension and hyperlipidemia. The client also suffers from depression and insomnia. And in 2009, the client had a stent placed. The client is on 5 medications currently and 1 over the counter. The first one is levothyroxine, 100 microgram tablet in the morning as replacement therapy since his thyroidectomy. 2, sertraline, 100 milligrams once daily for depression. Simvastatin, 20 milligrams at bedtime for his hyperlipidemia. Bisoprolol, 5 milligrams for hypertension once daily. And trazodone, 50 milligrams at bedtime for sleep. And the client also takes an 81 milligram aspirin daily since the stent was placed in 2009. So the individual is taking all the medications as prescribed, but I identified 3 priority safety concerns while I was there. The first one being the client's wife, who has a diagnosis of dementia, prepares his daily medications for him. So I instructed the client to go to the medicine cabinet alongside his wife to ensure that he is receiving the correct medication and dose at the correct time. The second thing was the client and the client's wife's medications are all in one cabinet together. I instructed the client to use a pill organizer to separate his medications from his wife's. Also, another idea might be just to put the medications in 2 different locations so they're not getting mixed up or confused. And the third point is the client's wife, like I said with dementia, was standing on a step stool to prepare the husband's meds. So the wife's age, her diagnosis of dementia, and also her medication she takes place her at increased risk for falls, and the fact that she stands on a step stool to prepare the medications is a safety concern. So I advised them to place the medications in an easier to reach location, as well as to have the husband accompany her when preparing the medications.